Good morning, everyone. I'm Dr. Madhu, consultant plastic surgeon at our Bahrain Specialist Hospital. Mommy makeover. This term has been trending in both in our plastic surgery department regarding surgeries and also in the social media for the past few years. There's a lot of buzz regarding this term, mommy makeover. So, what is it about? Motherhood is one of the most fulfilling and rewarding experiences in a woman's life. After the birth of the little one, there are no words that can describe the connection between a mother and her child. The connection is beyond words and it is purely magical. Becoming a mother is one of life's most rewarding experiences, but it often comes with physical changes that can leave many women feeling self conscious about their bodies. Pregnancy, childbearing, and breastfeeding are hard on the body. There is no doubt that creating a new life takes its toll. Even the healthiest, most athletic parent can find their body forever changed post pregnancy. Loose skin, stretch marks, stubborn pockets of unwanted fat, and loss of pre pregnancy silhouette. These are the complements, or these are the factors which one goes through. So, we'll just go through what are the body changes after pregnancy. Hormonal havocs. There are lots of hormones which goes up and comes down to accommodate the baby, to accommodate the body of a woman, and for the production of the milk and etc. etc. So these are all hormonal havocs which influences on the body of the female. Laxity and drag. There is a laxity on in the abdomen, and there is a drag of tissues because the body has to accommodate the new baby. Because of that, there is laxity and drag. There is issues of back pain. There are issues of knee pain because of the fluctuation of the weight. See, pregnancy is like in 9 months they need to uh, gain at least 10 to 20 kilos of weight and then lose that much. So there is lots of things happening during the time of pregnancy and after that. So what happens to a woman's body after birth of a baby? There are many changes in many parts of the body, as you know. So the primary changes are in the breast. The breast changes in size and they become saggy in nature. Abdominal muscles, the split in the muscles to accommodate the baby, they need to expand and then they need to come back to a normal shape. So this produces split in the muscles, also known as diastasis recti. There are changes in the vagina and perineum. There are changes in the legs, like spider veins, varicose veins, stretch marks. And there are many changes in the skin, like acne, chloasma, stretch marks, and also the menstrual cycle. So, coming to the breast changes after pregnancy, like right after delivery, the estrogen and progesterone levels and the prolactin levels act in various timing of that to produce milk, and all these things happen in the breast. This will lead to increased blood flow to the breast and milk production, leading to engorgement of the breast. They expand in size. This peaks 2 to 3 days after childbirth and will settle down as the baby breastfeeds. So the after pregnancy, breast could stay bigger, get smaller, or revert to its pre-pregnancy size, which is very rare. It is not uncommon for women to drop a cup size after pregnancy. So some women experience sagging of the breast skin, and this is due to the breast weight gain during pregnancy. Patients who smoke will find that they are more prone to skin aging as well. So what are the skin changes after pregnancy? Hormonal changes, stress, lack of rest brought on from new parenthood may affect skin along with the rest of the body. Some women will with perfectly clear skin during pregnancy will have more breakouts, while some rarely the acne may improve. Some women will notice chloasma. This is a darkened patch of skin along the lips, nose, or forehead, or a dark line running from belly button to the pubic bone. This discoloration will begin to fade in the months after birth. Depending on the weight gain and size of the baby, one may have stretch marks along the belly, and these will gradually become lighter in color, although they may not disappear entirely in majority of the cases. So, what are the changes in the abdominal muscles? After pregnancy, the core abdominal muscles can be weak, and most women would have some degree of diastasis, which is a split in the abdominal muscles as a result of the baby and enlarged uterus. So, the split in the abdominal muscles may narrow on its own after the first 8 weeks of childbirth, but if it often doesn't. So what happens because of this? The tummy that still looks pregnant after the delivery, and the core muscles that are still weak, and back pain from carrying heavy loads. Many women end up with a softer, floppier tummy, and how it firms up in the months after childbirth, it varies depending on many of the factors, like the genetic makeup, postnatal exercises, and how much the skin and tissues stretch during pregnancy. Like, for example, in case of twins, it stretches more, so the skin changes are more and abdominal changes are more. So what is mommy makeover? We are addressing all these issues with a terminology called mommy makeover. What is this? I will explain you. Mommy makeover is a catch-all phrase that refers to a specialized combination of body contouring procedures performed together to improve the physical changes that linger long after pregnancy. Certain individual procedures can address post-pregnancy concerns, but how will you feel if we say that all these procedures can be packaged together to give a complete makeover? So mommy makeover, one of the most famous procedures which can change any woman's life for good. So the goal of mommy makeover is to restore the shape and appearance of a woman's body after childbearing. Many women notice changes in their bodies as explained before. So a mommy makeover is typically performed as a single stage procedure. At its core, mommy makeover is tailored approach to plastic surgery that aims to restore the shape and appearance of one's body after childbearing. This comprehensive procedure is a blend of surgeries that focus on areas most impacted by pregnancy, such as the abdomen, breast, and waistline. Typically, a mommy makeover encompasses a variety of surgeries, including but not limited to abdominoplasty, like commonly known as tummy tuck, breast enhancement, augmentation or lift, and liposuction. So there are many areas of the body that can be addressed. Most commonly done procedures are on breast, abdomen, waist, genitalia, and buttocks. Who is a good candidate for mommy makeover? Person in a good medical health, person with ideal body weight, person with positive outlook and realistic expectations. They should have realistic expectations. Person who finished childbearing, and who should typically avoid getting a mommy makeover, are planning on having more children, want to lose a significant amount of weight because of these surgeries, want the surgery to please someone else rather than herself. These people should avoid doing all these procedures, and having postpartum depression. As the breasts and abdomen are primary areas of change with motherhood, a mommy makeover will often center around breast and abdomen procedures. So during pregnancy and breastfeeding, the breast will also enlarge, increasing as much as a full cup size or more. Returning back to normal can mean a significant loss in breast volume and noticeable sagging. And throughout pregnancy, the abdominal muscles, skin, tissues stretch to safely accommodate the growing baby. So this is before pregnancy, the muscles ideally look like this: the rectus abdominis and linea alba, they are tight. And during pregnancy, they expand to accommodate the baby. So they produce lots of stretch on the abdominal muscles. So this is a normal abdominal muscle. There is no diastasis recti pre-pregnancy. And during pregnancy, it stretches. And after pregnancy or after delivery, the stretch will not come back to normal position in majority of the cases. So it produces a gap in between the musculature. So this is the typical lady who appears after childbirth. She still looks pregnant. So this is the typical case of diastasis after the childbirth, after delivery, with sagging skin, with a stretch of the muscles, and she's still looking as though she's pregnant. So what are the benefits of mommy makeover? One may want to get a mommy makeover for different reasons, from wanting to fit into old clothes, improving quality of life, self-confidence, and relieving diastasis recti symptoms. If the person is having diastasis, they experience low backache and pelvic pain. So correcting abdominal separation with a tummy tuck may help to relieve some of these symptoms. Restoring some aspects of pre-pregnancy appearance. Breast lifts, both with or without augmentation, can help to reshape and contour the breast. This can help to reduce or reverse the effects of aging, weight loss, and or breastfeeding on breast size and appearance. So some people may experience a boost in sexual self-esteem after having cosmetic surgery. This means that they feel more confident in expressing their sexuality and initiating sex. Building self-confidence. Research suggests that some people feel more confident and have higher self-esteem after undergoing cosmetic surgery, such as mommy makeover. So we know the benefits of all these things, but why this mommy makeover is trending these days? Why it was not trending in before years, previously, like a decade or 2 decades ago? 20 years ago, a woman did not think she could do anything about it, and she covered up with discreet clothing. But now, women don't have to go on feeling self-conscious or resentful about their appearance. So attitude towards surgery also changed these years. So stigmas that previously surrounded cosmetic procedures like breast augmentation and tummy tucks have been broken as more women have embraced these surgeries as a way to get their confidence back. Partners are often supportive of the mother's decision to have a mommy makeover because the result is a wife and mom who is comfortable with herself and confident in her beauty. Plus, after the difficulties of pregnancy and infant care, a mommy makeover may be an ideal way for women to pamper themselves. So, possible procedures in a mommy makeover are breast augmentation, breast lift, breast reduction pertaining to the breast, abdominoplasty or tummy tuck pertaining to abdomen, labioplasty, liposuction, and BBL. BBL is Brazilian butt lift. So these are various procedures done for mommy makeover, combination of procedures. We can do 2, 3, or 4 of them all together. These are called mommy makeover. So we primarily address breast with augmentation or reduction. We address the body contouring with liposuction. We address tummy or abdominoplasty with abdominoplasty, and we address buttocks with buttock augmentation. These are the most commonly done procedures in case of mommy makeover. So what is a tummy tuck or abdominoplasty? So as I said, most people gain a significant amount of weight. The abdominal muscles and skin also have to stretch to accommodate a growing baby. These changes can lead to sagging skin and an abdomen that appears to stick out, as I have shown you in the previous picture, even after postpartum period. Some people who have given birth also develop diastasis, that is the gap in the abdominal musculature. More often than not, pregnancy confers permanent changes to women's body. A typical pregnancy entails, as you know, large fluctuation in weight over a short period of time. The degree of enlargement of uterus may be significant enough to cause irreversible stretching of the linea alba. Along with a fairly rapid increase in abdominal girth from pregnancy, followed by weight loss, many women develop sagging abdominal tissue and skin along their lower abdomen. Additionally, pregnancy often causes tears in deeper layers of skin, manifesting as stretch marks. These are reversible and irreversible, and no topical cream or laser have been proven effective until now for these stretch marks. So, the abdominoplasty or tummy tuck must be performed to address all these issues. Because abdominoplasty removes excess skin and results in an overall tightening effect on abdomen, subsequent weight gain will create additional irreversible damage to remaining abdominal skin and essentially reverse the abdominoplasty results. So thus it is recommended that a person has a stable weight and have not experienced significant weight fluctuations for at least 6 months prior to undergoing abdominoplasty. So this is the normal rectus abdominis. This is how the diastasis recti or the split in the abdominal muscles look like. There are various kinds of diastasis, like around the navel or below the umbilicus, above the umbilicus, or the whole from top to bottom. So the procedure of standard abdominoplasty, these are the 4 or 5 steps which we do in standard abdominoplasty. incision just along the pubic area. This is called along the bikini line, and incision here, umbilicus, and incision here. So this part is removed. This part is lifted up, and then we raise the flap like this, skin and subcutaneous tissue. In some cases, we do liposuction over this area until xiphisternum. So after that, we expose the muscles and we repair the muscles. The muscles are loose, so we repair all this, and then we drag this tissue down. So the extra tissue is discarded, and this is closed, and we create new umbilicus. This is one more picture representing this part is discarded, lower hanging part is discarded, and umbilicus is taken out. The muscles are repaired. This entire area, liposuction or the flap is raised until xiphisternum. So this typically depicts how abdominoplasty looks like. So the expected result is from this to this. The width is decreased. The length is now apt, and the umbilicus or belly button is looking nice. And the scar is not visible. It goes under the bikini. So these are the various scars of the umbilicus and also the tummy tuck. So there are many kinds of abdominoplasty based on the drag of the tissue: mini abdominoplasty, full abdominoplasty, inverted T. And in case of the excess tissue, both in front and back side, we do it as belt lipectomy. Circumferentially, we remove all the tissue and we stitch it back. So this is the picture: mini abdominoplasty, full abdominoplasty, and inverted T. The scars are like this: short scar, mini abdominoplasty scar, standard abdominoplasty, and extended. These are the scars. So these are all different pictures, before and after. You can see how her tummy was hanging before, and now the scar is not visible. It goes under the bikini, and we created new belly button or umbilicus. This is one more picture where we have repaired the abdominal musculature and removed the excess skin and created new belly button or umbilicus. This one with umbilical hernia, we repaired hernia also, and we removed the excess skin. This typically shows how the stretch marks are, and after that, it is removed. One more picture where there is a laxity and drag in the lower part of abdomen. So we removed everything. You can see all the stretch marks from here. One more case, before and after. Before and after. You can see the stretch marks. Entire abdomen is having stretch marks, and the belly button is not so good. So we created a new belly button. We contoured the abdomen, and we stitched it back. The scars go under the bikini. These are all various before and after pictures after tummy tuck. This one with umbilical hernia. Before and after. See the stretch marks. Entire abdomen, it is visible. Now after tummy tuck, because this tissue comes here, the stretch marks are not so visible now. Before and after. This case was done last month in our hospital. This is a lady. She has delivered 2 babies, and wherever she was going, they were asking that, "Are you pregnant again?" But she's not pregnant. She has diastasis recti, and her entire bowel was almost literally coming out of the abdomen. So this is how she looked when she came to us. She is ignorant of the surgery, that there is a tummy tuck, and wherever she was going, her relatives or her family doctor, they were telling that, "Are you a celebrity? Why do you want to do this surgery?" It's like that. You need to be like that. So she was ignorant of that. When she came here, I explained regarding there is a surgery called tummy tuck, and it is for everyone. Then she has undergone the surgery here. I'll show you a quick video. This is how, when we open the abdomen, And you can see there are no muscles there. I mean, the diastasis is so wide that her bowel and peritoneum is visible there, literally. You can see no muscle there. See, on pressure, the tummy is coming out just like that, because there are no musculature there. And this is after finishing. We have repaired. In this case, we use mesh also. And when we press, see, it's tight. It is back to normal. So that was regarding abdominoplasty. Coming to breast changes during pregnancy. Before kids and during pregnancy, during breastfeeding, and after kids, there are lots of changes in case of breast. So which breast surgery is right for a person? It depends. It depends. So what causes aesthetic breast changes? The changes in weight, pregnancy and breastfeeding, the age, genetics, everything acts on breasts, how they react, and how much sag they have, and how much big they become, and how much normal they become. So coming to breast surgeries, there are three kinds of surgeries: breast lift or mastopexy, breast augmentation or augmentation mammoplasty, and breast reduction or reduction mammoplasty. These are the three surgeries which we commonly do for the breast changes. So a breast lift or mastopexy is a surgical procedure that reduces the breast skin envelope and repositions the areola and nipple to more naturally anatomical location. It does not involve any removal of breast tissue and can be performed in conjunction with breast augmentation. So what is breast augmentation? Due to fluctuation hormone levels and changes in weight during pregnancy and breastfeeding, breast skin envelope may stretch, resulting in breasts that appear slightly more deflated than prior to pregnancy. A breast augmentation increases the fullness, size, and symmetry of the breast. The procedure is typically performed with the insertion of either silicone implants or saline implants or fat grafting. But majority of cases we use silicone implants, and these days we are doing fat grafting. So the breast augmentation versus breast lift, almost all both are same. Breast lift surgery and breast augmentation are often paired together to address both the volume and extra skin problems. If a person wants to increase size but does not have sagging, is a candidate for breast augmentation. If a person wants to reshape and lift the breast and are happy with the current size, she is a good candidate for breast lift. If a person wants to correct sagging and increase size, then she may need both. This is a pre-surgery. Post-surgery, we are expected the breast, the nipple and areola are raised up. The extra sagging tissue is discarded, and this is the typical incision. So breast lift incisions are anchor incisions, lollipop incisions, donut, and crescent. These are the various incisions by which we do breast lift or augmentation. Now coming to breast reduction, some female, they have huge breasts and they never goes back to normal shape. In that cases, we need breast reduction. So common reasons for breast reduction are they are unable to engage in physical activities, neck, back, and shoulder pain, breast sag or stretch skin, oversized areolas, rashes and skin underneath the breast because of the heaviness, and breast strap indentations, nipple positioning down and rest below the crease, inframammary crease. Breast reduction procedure typically involves reducing the size of the breast, and the weight of the breast. These are the incisions, circular, lollipop, and anchor incisions through which we do breast reduction. So these are the before and after pictures of this is breast lift or mastopexy. This one another case of breast lift, mastopexy. Breast reduction with mastopexy. We can combine breast augmentation, reduction, and lift, all these procedures. So this one, another case of breast lift. Another case of breast lift, you can see the nipple areola complex is raised and the size is decreased before and after. So the mommy makeover typically involves majority of the cases tummy tuck and breast augmentation. So I will show you how it looks like when we combine both tummy tuck and breast reduction or augmentation. This is a case of mommy makeover. Like I have done both tummy tuck and breast at a time. This one is a case where I have done liposuction, tummy tuck, and breast augmentation. I have inserted implants over her, and also I have done liposuction over her back. So you can see contouring of the body. This one, tummy tuck with breast augmentation. Tummy tuck with breast augmentation again. So next common surgery is liposuction, surgery or procedure. So we have gone through tummy tuck, breast, and now the liposuction. As you know, liposuction is a type of surgery which uses suction to remove fat from specific areas of the body, such as the abdomen, hips, thighs, buttocks, arms, or neck. So liposuction shapes these areas. The process is called contouring. Other names of liposuction include lipoplasty or body contouring. This is a typical way where how we do it. We insert a cannula underneath the skin and we suck all the fat. These are the areas which are addressed in cases of liposuction. We can do liposuction in the chin area, in the upper arms, upper abdomen, lower abdomen, outer thighs, inner thighs, knees, and calves. And in back, flanks, and buttocks also we can do liposuction. These are various areas which are commonly done. Liposuction is commonly done. Now we know that we do liposuction, we suck out all the fat. Previously, we used to discard all the fat, but these days, what are we doing with that fat? There's a terminology, new terminology going on in our field. It's called liquid gold. The aspirated fat, now there is a terminology called it's a liquid gold. A great new term in the world of plastic surgery used to describe body fat removed by liposuction and injected into desired regions of the body to enhance volume. The procedural term is lipofilling, fat grafting, or fat transfer, and harvested fat or the liquid gold can be injected into breasts, face, and buttocks. The result is enhanced breast size, rejuvenated and youthful face, and voluptuous buttocks. So this is the process where we do liposuction. We collect the fat, we centrifuge it, and we separate oil from the fat, and we inject the fat. It can be injected into the breast, it can be injected into the buttocks, into the face. These are various areas. It can be injected into the hands also to rejuvenation of the hands. Nowadays, we are using it more as nano fat. Hands, face, breast, hips, and buttocks. These are the common areas where we inject the sucked out fat. So now, the last procedure, what is a Brazilian butt lift? BBL, it is commonly known as BBL. A Brazilian butt lift is a surgery where fat is transferred from belly, hips, lower back, and thighs to the buttocks. The result is more of an hourglass shaped figure with large buttocks. This is not actually lift because it doesn't try to raise buttocks. Instead, it increases the volume of the buttocks. A BBL can give a smaller looking waist if the fat comes from abdomen or the lower back. It is a two-step procedure, removing the fat using liposuction. Then the fat is injected into the buttock area. It's an augmentation of the buttock region using a patient's own fat tissue. Enhances buttock size. So this surgery can increase the size of the buttocks, creating a more voluptuous and curvaceous appearance. This is achieved by transferring fat from other areas of the body, as I mentioned. And it improves the buttock shape. It contours the body. So fat grafting or BBL typically involves liposuction, fat injection, and we can see the result. So benefits of BBL are insufficient volume of the buttocks. It addresses insufficient volume of the buttock, sagging and loose skin, flat or squared buttocks. And you can see the shape helps to get decreased waistline like here in this case, and increase buttocks, full and curvy appearance, natural form and feel, because we are injecting the patient's own fat. We are not inserting any implants there. This is an on-table result of before and after of BBL. This is how it looks after the surgery, after this procedure. The liposuction is done in this area, so the fat is gone in this area and a nice hourglass appearance. And you can see the shape of the buttocks. This is before and after. Before and after. So after baby, there are lots of changes as we have seen. And we can address all these with breast lift, breast augmentation, breast reduction, liposuction, body contouring, tummy tuck, or fat grafting, any of these procedures. Actually, when we do 2 or more of these procedures, it is called as mommy makeover. So what are the facts and myths regarding mommy makeover? You have to be a mom to get a mommy makeover. Pregnancy often causes several aesthetic changes to the body, from excess sagging skin or on midsection to droopy and deflated breasts, which is why tummy tucks and breast augmentation or breast lift are popular choices for the combination procedures dubbed mommy makeover. Yet, changes to the appearance of breast and abdomen are also a part of natural aging process. Weight fluctuations, decreased collagen, and skin elasticity can affect any women, not just moms. That's why a mommy makeover is for everyone, no matter what the name implies. You don't need a mommy makeover if you eat healthy and exercise enough. Eating nutritionally dense foods and exercising regularly are integral part to overall health. These habits keep you strong, reduce your risk for heart diseases, diabetes, and other chronic conditions, and help you feel good. However, no matter how diligent you are with one's exercise regimen and commitment to clean eating, some places on the body may not respond the way you would like to. A mommy makeover can eliminate pesky fat pockets through liposuction, smoothing, and contouring the problem areas that won't respond to diet and exercise. If sagging skin under the arms, abdomen, or around breast is a concern, we can add an arm lift, tummy tuck, or breast lift to the mommy makeover procedure. You have to get 3 specific procedures for it to be a mommy makeover. No. While a mommy makeover often consists of a tummy tuck, liposuction, and a breast lift or augmentation, it's not limited to those options. A mommy makeover is a customizable set of procedures designed to address the areas one wish to enhance. So the choices are endless. You aren't limited to 3 procedures. You can choose 2 or even add more than 3. The recovery from mommy makeover is long and painful. Another common misconception about mommy makeover recovery is that it is longer and more painful than undergoing just one cosmetic surgical procedure. In fact, the opposite is true. Getting multiple procedures together saves you from extended recovery time because you only have to recover once. Most aesthetic surgery procedures require a couple of weeks of work, followed by 4 to 6 more weeks of slowly returning to normal exercise routine. Recovery after mommy makeover doesn't add recovery time, so why not get everything done at once and save yourself those weeks of recovery from multiple individual surgeries? Mommy makeovers are only about vanity. It's true that many women choose a mommy makeover to feel more confident about their appearance, and of course, they deserve to do so. However, there are also several benefits to various procedures that go beyond the mirror. A tummy tuck includes abdominal muscle repair, reattaching and tightening the muscles. A breast lift or reduction can ease shoulder strain and back issues. Thank you.